In 2021, an estimated 235,760 new cases of lung cancer will be diagnosed in the United States, and 69,410 people will die of this disease. To reduce the burden of mortality from lung cancer, the United States Task Force and the Centers for Medicare and Medicaid Services endorse low-dose computed tomography for current and former smokers who are at the highest risk for lung cancer. However, because decisions about lung cancer screening require patients to evaluate complex medical information within short time frames, some patients can experience anxiety, which can affect the quality of their healthcare decision. Therefore, the Centers for Medicare and Medicaid Services requires that counseling and shared decision-making occur with a patient prior to lung cancer screening. The U.S. Preventive Services Task Force also recommends shared decision-making in its Screening for Lung Cancer Recommendations statement. A lung cancer screening, counseling, and shared decision-making visit includes the following steps and is appropriately documented in the patient medical records. Number 1, determination of patient eligibility, including age, absence of signs or symptoms of lung cancer, a specific calculation of cigarette smoking pack years, and if a former smoker, the number of years since quitting. Number 2, shared decision-making, including the use of one or more decision aids to include benefits and harms of screening, follow-up diagnostic testing, overdiagnosis, false positive rate, and total radiation exposure. Number 3, counseling on the importance of adherence to annual lung cancer screening, impact of comorbidities, and ability or willingness to undergo diagnosis and treatment. Number 4, counseling on the importance of maintaining cigarette smoking abstinence if former smoker, or the importance of smoking cessation if current smoker, and if appropriate, furnishing of information about tobacco cessation interventions. And number 5, if appropriate, the furnishing of a written order for lung cancer screening. As mentioned, shared decision-making can be enhanced through the use of a decision aid. The Is Lung Cancer Screening for You decision aid is a brief, plain language, easy-to-use booklet designed to support shared decision-making. On the day of the patient's visit to your clinic, he or she should be provided with a copy of the decision aid. This aid should be available for use during your shared discussion about lung cancer screening. You can access a copy of the Is Lung Cancer Screening for You decision aid at lungcancersc.com. The next 5 minutes of this video will demonstrate how to use the Is Lung Cancer Screening for You decision aid to facilitate shared decision-making about lung cancer screening. The following is a role play to demonstrate how to engage patients in shared decision-making about lung cancer screening.
Good to see you, Ms. Smith. My name is Dr. Atwood. I understand that you are here to talk about lung cancer screening. Based on the information that you provided us through the lung cancer decision aid that you completed when you arrived, you may be at higher than normal risk for lung cancer. Would you like to talk more about the options for lung cancer screening?
Yes, but how do you know I'm at a high risk for lung cancer?
A thorough review of the evidence by the U.S. Preventive Services Task Force found that if you are a current smoker between 50 and 80 years old and have smoked one or more packs of cigarettes a day for 20 years, you are at high risk. If you quit smoking more than 15 years ago, you are not considered high risk. In the lung cancer decision aid, you indicated that you are 58 years old. Is this correct?
Yes.
You also indicated that you have smoked one or more packs of cigarettes a day for 20 years. Is this correct?
Yes.
You also indicated that you are either a current smoker or have stopped smoking less than 15 years ago. Is this also correct?
Yes.
Based on this information, you are considered high risk.
So what are my options for testing?
The recommended screening uses a radiologic test called a low-dose computed tomography scan. You've probably heard this referred to as a CT scan or a CAT scan to take a series of pictures of your lungs. For this test, you're in a donut-like machine for just a few seconds during the test. The test can be done annually.
Should I worry about the amount of radiation I'll get during the test?
The dose of radiation used with each screening test is very low, but we don't know the effect of repeated screenings over time. The radiation dose in a low-dose computed tomography is roughly equivalent to the amount of radiation you get over a 6-month span doing normal activities.
Are there any other risks related to the screening?
There is a chance that the lung cancer screening may show findings that may or may not be lung cancer. As mentioned in your decision aid, about 25 in every 100 people screened have small nodules. However, if the screening shows a suspicious nodule, I will refer you to a specialist who will help us determine if it is cancerous. The next step may involve another radiologic test or a surgical biopsy. If it is not cancerous, we will watch it closely. If it is cancerous, I will refer you to a cancer specialist to help us make important treatment decisions.
Do you think there are more benefits than risks to receiving lung cancer screening?
That is a great question. Lung cancer screening may detect about half of lung cancers at an early stage, which has been shown to increase the number of people who survive the disease. Screening is most beneficial to those with a significant smoking history, like yourself. However, I think it's important to weigh the benefit of potentially finding lung cancer early versus the chance of having to undergo unnecessary procedures because of abnormal results. Whether or not you decide to get lung cancer screening, stopping smoking is the most powerful way for you to lower your chance of dying from lung cancer or other serious illnesses. Continuing to smoke can shorten your lifespan and has many, many risks.
Is the test covered by my insurance?
As of February 2015, Medicare and Medicaid have agreed to cover lung cancer screening if you are eligible, so there's no cost to you. Now let's review what's important to you section from your decision aid. I see here that you are concerned about radiation from the CT, which we've already discussed will not be a significant risk with this test. Otherwise, I see that you feel that there's a lot of benefit from lung cancer screening for you and your family. Do you still feel this way based on our conversation?
Yes, I feel the screening might be important to my health.
Do you have any other concerns about screening that I might be able to address?
No, I do not have any additional concerns.
In the decision aid, you also marked that you felt that it was important for you to get the lung cancer screening within the next 30 days. Do you still feel this way, or has your decision changed?
Based on our conversation, I feel that receiving the screening may be a benefit. What do I need to do from here to get screened?
I will put in a request for you to be screened within the next 30 days. The coordinator or nurse will call you on the phone to schedule your appointment within the next 2 or 3 days. How does this sound?
This sounds good. When will I know my results?
Typically, we will receive your results within the next 2 or 3 days, and we'll either call you or have you come in for a follow-up appointment to discuss the results. Are there any other questions or concerns?
No, I think this is all my questions. Thank you.
Thank you for coming in today, and we will get you set up for your lung cancer screening. If you have any further questions or concerns, please do not hesitate to call our office.
After you've completed the 5 steps of counseling and shared decision making and documented, as in this example with Ms. Smith, you should use the billing code G0296 for reimbursement of approximately $29 using 2021 Medicare rates. Medicare also requires that you use one of the following ICD-10 codes to be reimbursed: Z87.891 for former smokers and F17.21 for current smokers. As long as the requirement for the counseling and shared decision-making visit are met, the counseling visit may be billed on the same day as a medically necessary E&M visit or an annual wellness visit with the 25 modifier. The shared decision visit is not subject to coinsurance or deductibles. The shared decision-making visit can be conducted by a physician or a qualified non-physician practitioner, such as a physician's assistant, nurse practitioner, or a clinical nurse specialist. The following is a suggested template for documenting your shared decision-making discussion with your patient.